When last did you check your BP? You can't remember? Let's talk about hypertension. Normally, blood flows through the vessels to carry oxygen and nutrients, and the heart pumps this blood with a certain force. The arteries, which are blood vessels in the body, are meant to stretch and relax in order to handle that pressure. But when these arteries become narrow, stiff or clogged, the heart now has to pump harder with a greater force in order to push blood through it. And by so doing, there will be increase in pressure inside your blood vessels. In fact, the higher resistance your blood meets inside your blood vessels, the higher your blood pressure. Now, when do we say someone has high blood pressure? A person is said to be hypertensive when the pressure at which the heart pumps blood is consistently higher than normal, even while the person is resting. Blood pressure is measured using two numbers, top number and bottom number. Top number, otherwise called systolic, indicates when the heart beats. Bottom number, on the other hand, otherwise called diastolic, indicates when the heart relaxes. Now, here are the standard ranges. Over here, we have BP level, that is blood pressure level. We have systolic, which is the top, and diastolic, which is the bottom. So, normal BP level is less than or equal to 120, all over less than or equal to 80. Now, elevated, which we call pre-hypertension. In this type of, in this elevated or pre-hypertension, it shows that this person's blood pressure is already high, but it is not high enough to be classified, for them to be classified as being hypertensive. But if care is not taken, there is a great chance that they might go into being hypertensive. So under this elevated, the range is starting from 121 to 129, all over less than 80. Then we have stage 1 hypertension, which ranges from 130 to 139, all over 80 to 89. Then we have stage 2 hypertension, which ranges from 140 or above, all over 90 or above. Then we have hypertensive crisis. People with this type of hypertension, So we have hypertensive crisis, which ranges from 180 or above, all over 120 or above. Notes: a person is not diagnosed to be hypertensive by just one check or reading. One's blood pressure must be high on repeated checks and on different days, even while at rest, before you can conclude that they are hypertensive. There are three main types of hypertension, which are primary hypertension, secondary hypertension, and pregnancy-induced hypertension. In primary hypertension, it is otherwise called essential hypertension. There is no specific cause and it develops slowly over time. It is common in older adults, people with family history of hypertension, or poor lifestyle habits. Secondary hypertension is caused by underlying conditions like kidney disease, hormonal disorders, use of certain drugs, tumors affecting blood pressure control, etc. In pregnancy-induced hypertension, some women develop high blood pressure during pregnancy, known as gestational hypertension, or a more serious form called preeclampsia, which affects both mother and baby. Now, who are those that are at risk of developing hypertension? Number 1, people who have a family history of hypertension. 2, those who are obese or overweight. 3, salt lovers. 4, smokers or alcohol drinkers. 5, people who don't exercise. 6, people who undergo too much stress. 7, those who have diabetes or kidney diseases. And lastly, pregnant women. What are the signs and symptoms of hypertension? Most people with hypertension don't show symptoms at all, and that is why it is often referred to as silent killer. But in cases where symptoms appear, you may notice headaches, especially in the morning, chest pain, dizziness or blurry vision, nosebleeds, swelling in the face or legs, tiredness or confusion, and lastly, shortness of breath. Dangers of untreated or uncontrolled hypertension include stroke, heart failure, heart attack, kidney damage, vision loss, complications during pregnancy, and sexual problems in men. Here are what you can do to prevent or manage hypertension. Number 1, eat less salt. 2, exercise regularly, at least 30 minutes in a day, 5 days a week. 3, maintain a healthy weight. 4, eat more fruits and vegetables. 5, quit smoking and limit alcohol consumption. 6, know how to manage your stress. And lastly, get a regular BP check, especially if you are 35 years and above. And if your blood pressure is already high, there are different types of medications that your doctor may start you on. Some helps to relax the blood vessels, some helps the body to get rid of excessive salt and water, while some helps the heart to beat with lesser force. But all these drugs depends on your age and other health conditions like diabetes, kidney diseases or pregnancy. Please, never you stop taking your BP medications just because you feel better, because it can come back, and this time with a full force, and in most cases it results to death. So please share this video so others can learn.